I understand the consent that the following information will be gathered and utilized for educational purposes by Indiana Wesleyan students. I allow this information gathering and physical assessment to be videotaped and posted on YouTube for access by faculty at Indiana Wesleyan University. This video will be deleted by the student as soon as it has been reviewed and graded. I further acknowledge that this is for educational purposes only and that information is not meant to be diagnostic. Therefore, Indiana Wesleyan University, the faculty and staff, as well as the students, are not considered liable.
Hello. Hi, Michael.
Hello, Nurse Berman.
Today we are going to perform head-to-toe assessment, which is part of the class for Indiana Wesleyan University Nursing 334, and I will perform it with help of Michael. Okay, and this is going to be videotaped. So we start with inspection of skin. So we inspect skin to see if it's evenly colored, if the tone is even. We note if there is existence of pallor, of cyanosis, and we check also skin for warmth. We see the turgor. We check the capillary feel of nails at the same time, and they also look how the nails look, if they're clean, if they're even. And we ask if, do you have any lesions, any wounds anywhere on your body?
No.
Okay, good. And also see if there are any freckles, moles, scars, and things like that. Then we move on to hair. Can you remove your
My keeper? Yes,
Please.
I can, Nurse Berman.
Okay. So we look at head. We check the color of hair, if it's evenly distributed. We check if head has any depressions, any bumps. And at the same time we can check sinuses. Any pain?
No.
Any pain here?
No.
Check for temporal vein. And we can also check the TMJ. Can you open and close your mouth? Just slower. Slower. Any pain?
No.
Okay, that's good.
May I put my keeper back on?
Yes.
Thank you.
Yes, you can. Next is eyes. And so with inspection, we start. Look at the eyes. If there is any jaundice, the sclera is white. Also pull down a little bit. See if the conjunctiva is pink and nice, which it is. See that eyelashes, eyebrows present and they're symmetrical. And then we just check the pupils, see if they're reactive to light. Okay, you just look straight. No, just look straight. And we check how they react to light. That they dilate and they constrict. And we check the peripheral vision also. Just tell when you see my fingers moving.
I see them.
See them now?
I see them.
See them now?
Yes, I see them.
Okay. And we can also check for nystagmus. Just follow with your eyes. And their accommodation. Just look at the pen. Okay, good. Next is the nose. So we check for any gross deformities, check for symmetry for the nose. And we ask him, can you just occlude one nostril? Close your eyes. Just close your eyes. Can you smell?
Yes.
What is it?
Coffee.
Okay, can you occlude another nostril? Can you smell this?
Yes.
And what is it?
Coffee.
Okay. Okay, that's good. Alright, next is the mouth and throat. So we look at lips, look if there is any cracks. There is none. I will look at your tongue a little bit later.
Okay.
Look at sores. Can you show me your teeth and gums? just like this, and teeth are white, they're even, they're present.
I only have one cavity.
Oh, that's good to know.
Okay.
You have very good teeth.
Yes, it's true.
And next, just open your mouth. Open your mouth. All right. Say ah.
Ah.
Okay, and we'll look at buccal mucosa, and its even color. We check if uvula is midline, which it is. And also we assess tonsils. Okay, next is the neck. So we look at the neck, that it's aligned, that there are no any visual masses, no lesions. And we start palpating the lymph node, starting preauricle, here, tonsilla, submental, and then we go subclavicular. And they are not fixed, they are not hard. So, which shows that there is no inflammation, at least at that time. And at the same time, we also can check the thyroid. Just stand behind. All right. And what else? Okay, and one more thing. So there is no enlarged goiter. And one more thing, we can check the trachea so that we can move it. It's movable. Okay. All right. Now, musculoskeletal assessment. So we look first at fingers. And we palpate them for tenderness, for rheumatoid arthritis. Note any swelling, inflammation. Can you do like that? And extend. And again. Okay. Then we can also check the wrist, range of motion, flexion, extension. And you do like that. No, can you like make circles? Okay, good. And then we can also at the same time check for carpal tunnel. So you hyperextend the hand, press here, any pain?
No.
No, okay. And at the same time we can do the Allen test, just occlude radial and ulnar arteries. Make a fist. Occlude the arteries, open your fist. And then you let go one, and it should turn pink. And the skin does turn pink. Do a fist again. And occlude again, open your fist, and it turns pink. Okay, so next, we look at elbows, we look at any masses, any deformities, we check the olecranon process. Okay, we do both. Any pain here?
No.
No signs of inflammation, and we check the range of motion. So extend, flex. Okay, good. All right. Okay, and then we go all the way to shoulders. So we inspect also for masses, for deformities, and we palpate starting with suprasternal notch all the way to acromion process. Any pain in your shoulders?
No.
Just do like this. Okay, and it doesn't feel like it has any deformities, any masses, or any sort of things like that. All right, let's do extension and flex. And if you can do circles, there is not enough room, but he is fine. And can you give yourself a hug? Which is a cross-body test. And he can perform that too. All right. Scratch your neck. So if there is any pain here, this is indicative of rotator cuff injury. And can you reach the opposite shoulder blade? Any pain?
Yes, no.
And with another hand also? Okay, good. Okay, neck. So we inspect for any deformities, feel for tenderness, feel for warmth. Can you tuck your chin? Look at the ceiling. Look at the ceiling now. Turn left. You can look straight now. Turn left, turn right. And touch your shoulder with your ear. This is lateral bending. So he can perform the whole range of motion also. Alright, next is our spine. So I will have you stand up in front of me. Okay, no, like this. Stand in front of me. Alright, and so we look that cervical neck, cervical spine is a little bit concave, thoracical convex, and lumbar has a natural lordosis. And then we palpate starting with C7 all the way down. All the way. Okay, and then we ask a patient to bend. Can you bend forward? And at this time we check for scoliosis. And there is none. Okay, you can stand straight.
Drop my keeper.
Okay, stand straight. And then we check the range of motion. Okay, so can you twist left and right? Okay, and bend. And bend onto the sides like this. Okay, very good. That's enough. That's fine. You can sit. So then, hips. Any pain in your hips?
No.
No pain. Okay. Actually, can you stand back? This test we can do either when the patient is lying or if he's standing. So I'll have him standing for this time. So can you stretch your leg forward and backward? Okay, any pain on your hips?
No.
You can do it. And another leg also.
Open.
Okay, good. You can sit. Alright. Then we look at the knees. Knees are symmetrical, they're warm, there is no tenderness, no pain.
No.
Alright, can you extend and flex, and another knee also. Alright, and can you put them close, and try to open against my, alright, and try to close against the resistance, and he's doing that very well too. Okay. So then we can check for the knee effusion. Just a little like this. And we also check the patella for effusion if there is any collected fluid. And there is none. We check the patella groove at this time. Alright, and the last is ankle and foot. And the same, we check for deformities, check for pain, for inflammation, check the heel, and another one also. And check the range of motion. Can you extend your feet and flex towards yourself? And do eversion and diversion sideways. Okay, and do the circles. Now with your ankles. Oh, sorry. Alright. Okay, that's good. So next is the lungs and thorax. So first we'll look for respiration, if they're even, if the patient has to give any effort, if it's shallow, and it looks fine. If it's rapid, and then we can auscultate. We start with anterior aspect. So every time you feel my stethoscope touch, you will be just taking deep breaths, okay? Take a deep breath. Okay. Okay, that's good. And majority of his sounds is vesicular, but we can also check for air trapping when he says the word. Sorry. Ask him to say the word 99.
99.
And check for resonance.
99. 99.
Okay, we do the same thing at the back. So lean forward and